Is a really challenging time, and we're so appreciative of your continued love, compassion, and support. Willis, of course, best known for his role in the Die Hard franchise. So on the Medical Watch today, we're taking a closer look at aphasia, which can be debilitating. It impacts the ability to speak and understand spoken and written language, often caused by a stroke or other head injury. The disorder is frustrating. Therapy can make a bit of a difference. Joining me now with more on aphasia and the journey is Dr. Michael Chen, professor of neurosurgery at Rush University Medical Center. Doctor, thank you for being here.
Thank you for having me.
Talk about diagnosis. What are some of the key symptoms that you look for?
Well, the diagnosis of aphasia is a little bit nuanced. You have to make sure it's not somebody who's, confused or tired or delirious, but it's clearly and specifically a problem with language. Oftentimes you ask them to name certain objects or to repeat sentences or to follow commands, and that's how you'll be able to know it's truly just really a language problem.
So what's happening in the brain that's leading to that problem?
So the brain, unlike other organs in the body, the function depends on where on the brain it is involved. So generally in most people, it's the left side of the brain. It's close to the surface, a little bit back, called the, sort of the posterior parietal lobe. That's where language is controlled. And any injury, even if it may not necessarily be a very large injury, can cause a significant loss of language function. And it can manifest in a mild aphasia, which is just some word finding difficulty, to more severe cases where somebody unfortunately can be completely mute and not able to really communicate.
Wow. So when you talk about an injury, Bruce Willis didn't report having a stroke or any real traumatic brain injury, but he certainly did a lot of stunts in his movies. Could some of those prolonged injuries lead to this?
It's possible. I think the amount of information that's been made publicly available is pretty limited. It doesn't sound like it's a stroke. It may be a part of a larger syndrome of what's called a degenerative disease. And if there had been a history of concussion or trauma to the brain, that may put him at risk for it. But right now, based on information we have, it's very difficult to know for sure. Maybe imaging would be helpful.
So when you talk about a degenerative disease, I think a lot of us think Alzheimer's. How does it differ from Alzheimer's, and how do you differentiate in the diagnosis?
Yes, I think Alzheimer's, as everybody knows, is a lot more common, which usually is characterized more prominently with memory problems. That wasn't really mentioned so far with this story. With aphasia being the primary concern, it oftentimes, if it's mixed with other cognitive complications like concentration, attention, calculation, orientation, and insight. Those are the other things which kind of help give you a better sense of, the nature of the degenerative disease. So I think, it's limited information so far, but we're hoping it's something mild and hopefully a mechanism that may be reversible. We may be able to see some improvement. We just don't know right now.
Dr. Chen, in the stories that I've done, I know people do go through therapy, but truly, what is the meaningful prognosis once you're at a stage where you really are not functioning very well?
Again, it really depends on what's causing the aphasia. If it's something that's more irreversible, like a stroke or actual changes in the brain tissue, the prognosis for recovery can be more guarded. But if it's something that's related to just some sort of pressure or something that's reversible, like bleeding or tumor or something like that, then the aphasia can come back over time.
Oh,
a lot of times the severity of the initial aphasia may determine the prognosis. So we just don't know until you have a better sense of the actual diagnosis. It's important to remember that aphasia is merely a symptom of something else. So, yeah.
Very quickly, how many people in this country suffer with aphasia?
Well, aphasia can be a very common symptom among stroke, which I think is the most common cause of aphasia in the United States. And that can occur in about 800,000 people each year. But that's, just a proportion of them, of stroke patients with aphasia. It probably affects on the order of tens to hundreds of thousands of people in the U.S. each year.
Wow, and it's such a struggle.
Yeah.
Yeah, Dr. Chen, thank you so much.
Oh, well, thank you, Dina.